Hi, everyone. My name is Rebecca Perry, and I'm the Director of Marketing here at Patients Like Me. I'm joined today by Dr. Andrea Vidali, reproductive endocrinologist and reproductive surgeon who specializes in endometriosis. Dr. Vidali is a world-renowned surgeon and top endometriosis expert, and as a patient with endometriosis myself, I'm thrilled to have him here today. Welcome, Dr. Vidali.
Good evening, Rebecca, and I'm sorry, of course, the internet sometimes comes in and out, so I hope we get a good connection, but thank you for having me here this evening, and I'm really looking forward to a conversation about a topic that is very, very close to my heart.
No, likewise, same here.
Which is endometriosis.
Yeah. I mean, and it's great because doctor perspective, patient perspective, which I think is really going to be great for this. I'm really glad we could be doing this, especially just in time to close out Endometriosis Awareness Month. It's interesting because in my own personal journey, I found that as common as endo is, so many people, including medical professionals, don't really know anything about it, which seems shocking to me, and leads me to my first question for you, actually, which is, for our viewers at home, in your own words, what is endometriosis?
Well, endometriosis is not just bad periods. I think that most people who do not know anything about endometriosis think, oh, endometriosis is just bad periods. But endometriosis is not just bad period. Endometriosis is a painful and debilitating condition that includes much more than painful periods. Symptoms may include bladder problems, IBS-like symptoms, bloating, painful sex, pelvic pain, infertility, menstrual issues, back pain, and fatigue. It's a very complex condition that affects people's life in a very deep and profound way. What endometriosis is caused by is by the presence of lesions in the pelvis that can be anywhere in the pelvis, but can also be anywhere else in the body. It can be in the chest, it can be on the diaphragm, most in the abdominal cavity, but sometimes beyond the abdominal cavity. And these lesions resemble, but they are not like the endometrium. They're just similar to the endometrium, but not like the endometrium. They're not endometrial tissue. And they can develop and grow. And depending on their presence, they can cause all the symptoms that I talked about above. So it's a very complex condition. And it's not just cysts. People think, oh, I have cysts. That's also not a good definition, although cysts can be present in endometriosis. So there's a complexity there to the disease. And this is one of the reasons why that there's not enough knowledge about it, both on everyday people's mind, but also in the doctor's mind as well.
Right. That's a fantastic answer. And I mean, I know firsthand, just how real that is, and how oftentimes a patient will go from doctor to doctor to doctor and still not have any answers and still be, left wondering what's wrong with me. Is this all in my head? Am I making it up? Am I just imagining that I'm in this much pain? And oftentimes, it could take years, right, to get a diagnosis. So really, I wanted to... Go ahead.
No, please.
Oh, I was just going to ask, how is endometriosis diagnosed, and how long does it typically take for someone to get a diagnosis?
Well, I think your personal description of your personal story is very much goes along the lines of what's happening to people. When you're looking at actual hardcore data, there's plenty of evidence that shows that the time to diagnosis for individuals with endometriosis is up to 8 to 10 years. And the number varies. I've seen some research that shows 6.5-year delays, others that show like 10 years delays. Regardless, the diagnostic delay in endometriosis is incredible. And one of the reasons is physicians are not informed enough about this condition. There also has been a form of bias where I think if, patients with endometriosis are not taken seriously. This idea of gaslighting, where individuals are being told that the pain is what you just described, that the pain is all in one's head. This idea of which goes back century, if not millennia, right? The concept of hysteria, this idea that is something in one's mind, whereas there's instead the person is dealing with a very profound physical ailment. And this is one of the reasons for the delay. And doctors are just not educated in this. Now, getting to your to your question, the diagnosis of endometriosis is complex, and this is one of the reasons why there has been a delay. Mostly because, and the major reason why I think it's complex is that there is little correlation between the amount of disease and degree of pain. So, individual with a diffuse, extensive disease may have less symptoms than somebody with minimal disease. So, because of this disconnect, individuals with significant pain may have minimal disease, so that doesn't get looked for. But the diagnosis, therefore, has to be made by looking at the individual holistically. So one has to look at the history, the personal history, and sometimes the personal history of pain, for example, goes back a long time. Okay, so when I talk about personal history, we're talking about personal history from a perspective of both pain as well as fertility, because fertility is also a symptom of endometriosis, right? Combined with diagnostic studies. And the diagnostic studies, of course, include ultrasound, MRI, and other forms of imaging. And of course, you have to include the physical exam. And putting all these together reaches the diagnosis. So I think that one of the reasons why diagnoses are being made right now is that, number one is, I think doctors should probably listen to the patients more. Right. And that may be a great place to start, I would say.
Oh, I agree with that for sure. I think it's across the board too, not just for endometriosis, but just healthcare in general. But absolutely. And that's, I think that kind of brings me to my next point too, is so if someone has, let's just say, imaging that comes back and it looks like they, like endometriosis may be present, the next step is usually surgery is recommended at that point. Is that correct? And if so, I know there's a difference between excision and ablation, and a lot of people go down the path of getting ablation first, not realizing that that's what they're getting, and they end up in more pain afterwards. So why is excision the gold standard, and are there other treatment options for patients other than surgery?
Well, let's just start by saying that the management of endometriosis as a condition has to be multidisciplinary and multimodal. You can't just think that one intervention is going to completely solve the problem, right? So let's just say that, first of all, that care must be individualized to the person, depending on what the nature of the specific problem is, the duration of the disease, what the objectives are. For example, fertility may be a priority in certain cases, pain may be in a priority cases. But having said that, the treatment of endometriosis care should include excision of the disease at its root. And what excision means, it means that the disease has to be excised, means to cut out, and removed. In general, whenever we are dealing with any sort of abdominal or so any sort of tumor, and we go in to remove it surgically, we don't normally burn it, mostly because when you burn something, which is the concept of ablation, you never really know factually that all of the disease has been completely removed. I always tell people that you don't burn a melanoma because you never know you actually burned it all, right? You cut it out and you make sure that the margins are clear. Now, endometriosis is not cancer, but the same principle apply. So the disease has to be removed and cut out. And this is what excision is removal of the disease at its root. And that should be the gold standard of care, which I think things are moving in the right direction now, but I don't think it has been completely fully accepted. And that's for a number of reasons. And mostly the main reason is that excision is a little bit more difficult technically to perform than just burning the disease. And therefore, most institutional organizations have accepted ablation as sort of like a minimum standard, but it's an inadequate minimum standard. Let's put it that way. And so this is the first part of it. And I would say that the other reason why excision is more important because it lessens the incidence of recurrence, which is also like a big problem, a bigger problem with ablation than with excision. After that, after excision, the care of endometriosis must include a multidisciplinary team to assist in the other facets of the disease, and this has to include physical therapy and nutritional therapy, pain management, for example, very, very important. And therefore, you need a team around a patient in order to deliver this. And I think one of the greatest dilemmas for patients is that where does one find these people? Where does one find these multidisciplinary teams? And where does one find about what endometriosis is? And I think that, patients like us is something that you guys are doing, right, as well, right? Like in terms of figuring out what to do, on how to reach out to people.
Yes, absolutely. Absolutely. And it is, I mean, everything you just said just hits so close to home for me, because I remember when I got my initial diagnosis through surgery, and I was just told, oh, you have a cyst and it needs to be removed. And I had no idea what I was doing. I just was like, okay, I'm just getting surgery. No big deal. And it was with someone who was just a regular gynecological surgeon and didn't have any expertise in endometriosis. And I ended up, so much worse off. And thankfully I found you, through, I think it was through a Facebook group at the time, not, knowing that there's other support groups such as Patients Like Me out there. But, it's hard knowing who to turn to, because everyone, says they're a specialist, but are they really? And to, come up with that team, like you said, after excision, to really, enable the patient to have a good quality of life. Oh, go ahead.
No, I think Patients Like Me represents what's happening today in healthcare in a positive way, which is we are in an era of crowdsourced knowledge, where more often than not, one gets more information, more resources from patients like me
Yeah.
than from the traditional resources, calling a number, looking to the website of a university, and and so on and so on. By promoting advocacy, by promoting information, by promoting not only information about what the disease is, but about resources that are available, I think that organizations like Patients Like Me are helping today, speeding up access to disease, speeding up diagnosis, and ultimately that, believe it or not, results in improvement in healthcare utilization as well. Because if somebody is floating around from one doctor to the other doctor, then gets a suboptimal treatment, and then gets more chronic, and the lady gets, ultimately that is also results in suboptimal utilization of the healthcare resources. So I think that patient advocacy is extremely important, and which is also what we've done with the endometriosis as well.
Right. Do you care to elaborate on that and, and talk about that? Because actually one of the questions I wanted to ask you was, in 2018, you co-founded the Endometriosis Summit with the hopes to spread awareness on the disease, but also to unify patients, practitioners, and doctors across the board to learn from each other, open and honestly, about the role that endometriosis plays in patients' lives. And, I was really wondering from your perspective on that note, what role does patient advocacy play and the patient voice play in endometriosis, all the way from diagnosis to treatment?
Well, Rebecca, patient advocacy is huge. It's huge. It's absolutely so powerful. First of all, let me just first say and give credit to Dr. Sally Sorrell, who is the co-founder of the Endometriosis Summit and the major force behind it. Dr. Sally Sorrell is a physical therapist, a very experienced physical therapist, who also is a patient who had endometriosis, and she needs enormous credit because her voice is being so powerful. And when you're asking me, the goal of the Endometriosis Summit, like you just mentioned, is sort of to bridge this gap between patients and doctors and practitioners. I should always say and practitioners, not just doctors. It's physical therapists, it's physiatrists who are doctors, but some are doctors in physiatry, some are MDs or DOs, and patients to bridge that gap. And I can tell you that some of these conferences that we have organized and some of the other work that we've done has been extremely powerful, because I can tell you that no matter what the cognitive biases of certain physicians are, no matter what the cognitive biases of certain institutions are, the force of the patients is so strong that it cannot be ignored. It cannot be ignored. It does not get ignored. And when individuals are speaking up and are saying that, for example, one of the big things for us is that endometriosis and pelvic pain must be inclusive to everyone, regardless of age, race, sexual orientation, gender, socioeconomic status, and that the patients have to be respected in their fertility choices. You can't just throw a hysterectomy at people just because you want to do a hysterectomy, right? And you tell them, no, I'm not going to take care of you if you don't want a hysterectomy, okay? Or a desire to have a healthy or happy or active life. And all these things together, doctors need to acknowledge and recognize. And I think the force of these organizations has really pushed things forward in a very, very positive way. And we're seeing results. We're seeing results every day. And people will not be ignored, like they say. And I think that in every field, in every area, we're seeing it in every aspect of society. It's a human right thing, ultimately, I think.
I think so too. Absolutely. And that kind of goes back to a question I wanted to ask earlier when we were talking about, surgery and different treatment. Do you think that plays a role in the fact that, most surgeries are very expensive, significant number of people in the country are, uninsured. And so that limits access to treatment. Is there anything that you know about yourself in terms of how you're, you run your practice to help those who, might not have the financial means? Or is there anything that you would recommend for patients who, maybe need treatment but feel like they're stuck?
Look, there are structural problems in our healthcare system as a society in the United States, right? And the problems are deep and ingrained in our society to the degree that there are huge problems of access to care. And I don't believe that I can solve all these problems alone, although I can tell you that I try to do my best. And personally, to me, if people show up and don't have insurance, I try to help. But change has to become from a structural standpoint. Although I have to tell you, one thing I have to tell you. Sorry, my daughter was just saying. One thing I have to tell you is that sorry.
It's okay.
Although sorry about that. One thing I have to tell you is that when I look at other countries, we could complain about the United States as much as we want, but when we look at other countries, it's not that they are in much better shape than us. I can tell you that I look at, and I don't want to name countries, but Canada that we always look up, or the UK, they're in terrible shape when it comes to endometriosis. Okay, so I think the problem is widespread and diffuse, and it's lack of knowledge, lack of access to care. Because if you have endometriosis, you're not going to wait 3 years for surgery because you don't have access to a surgeon.
Yeah, exactly.
So I think these are deep problems that need to be addressed, and I think ultimately these are big questions. From a policy standpoint, from insurance companies' utilization reviews. It's a deeper conversation, and maybe more technical, but I'm going to mention it anyway. Uh, Certain procedures should be done by experts. And perhaps insurance companies should also look at that, right? They should say, all right, you should be qualified to do this thing, and we should look at your outcomes and see what you're doing. That's from a surgical standpoint. And ultimately, that's what insurance companies do with utilization reviews and things like that. But ultimately, some sort of data collection has to happen, I think, in order to validate procedures, validate outcomes, validate performance. I don't know how that's going to be done, but I think that's kind of the future, and I think that's where a lot of energy has to be put in. I think that's one big part of it.
Agreed. I think that was a great answer. And actually, on that note, speaking of the future, you do seem to be sort of on the forefront of research, new technologies, and just, knowing what the latest advancements are. Is there anything that looks promising in the pipeline that you're aware of as far as, maybe a future cure or new treatment options?
I think, to be honest with you, in my opinion, the way I look at the future is that I think that interventions need to be assessed on a quantitative way. In terms of there's always going to be new drugs. We didn't talk a lot about medical, and we can talk about it in a minute, but medical management of endometriosis. I'm a surgeon, but I could say a little bit about medical management as well, because I do a lot of that too. But one of the things that we need to look at is quantitative analysis of intervention. And I think one of the biggest problems in endometriosis is that there's absolute lack, or sort of like limited quality of research in endometriosis compared to some other fields. I mean, there's limited. Medicine is pretty bad, but I think that in endometriosis is even worse. And I think that more sophisticated data analysis, artificial intelligence, and I'm doing some work with artificial intelligence, so I know quite a bit about that, will allow us hopefully to analyze data in real time, and especially with what's called white box artificial intelligence, where we'll be able, I think, to give better answers to people. Because today, I think that that's one of the problems that we have. So I think in that area, I see the progress. I really see progress in that, because I think right now there's a lot of approaches, there's a lot of treatments that are being given. Try this, try that, try this, try that. It didn't work, try that, try this, try that. There aren't really good algorithms. It's really a problem. It's a problem in care in general. But you go to a doctor, say, what do you try? That, okay, try this. This has to change. Things have to change in that direction. And I wanted to say something about medical management of endometriosis, because we didn't talk about that.
Okay.
And I'd like to just sort of like, as we're running out of time, I'd like to say that there is, of course, a place for medical management. When we say about medical management, we're talking about hormonal management, of course. And one of the things that I have to say is that it's for the longest time, hormonal management of endometriosis has been like the treatment for endometriosis, right? That was the go-to treatment. And the problem with medical management has been that although it helps with the symptoms in some people, And so there's validity to that. The issue is that it can sort of mask the disease and delay diagnosis. And so one has to be very careful with by, just tell by as a patient, I would say I would advise if a doctor tells you, well, you may have endometriosis. Well, we don't really know, but in the meantime, just take these birth control pills. That may not be the right approach. I think maybe trying to achieve a proper diagnosis may be the way to go. And so I think that's something that needs to be included in the thinking, right? Not just like slap hormones on somebody. And
this is a Band-Aid.
I think that, more critical evaluation should be done.
Yes, absolutely. And I mean, again, I know from the patient experience just how true that is. It's just like constantly giving Band-Aids to just put over the problem, but not really like addressing the problem at its root and really trying to get to the root cause. And like you said before earlier, like, treating everything holistically, and, having like a personalized approach for each patient. Great.
That's what the future is.
Yeah, no, I agree. Absolutely. Is one question I didn't actually ask, is endometriosis lifelong? Or, I mean, what are the statistics that say, a patient who has excision, the percentages that, they might come back and they might need another surgery?
Look, the statistics are all over the place, and the reason why they're all over the place is because there isn't been appropriate data collection. And so the question is that what is the chance that that endometriosis becomes a chronic condition that sort of like isn't just cured? Because really that is the real question. Can we today cure endometriosis, cure it? And the answer is that we can't really cure endometriosis completely. Unfortunately, endometriosis is a chronic ailment, and so I think although some individuals can expect a cure or a significant resolution, of almost complete resolution of their symptoms, whatever they might be, I think that the way we have to look at it is that unfortunately there's a chronicity to it that cannot be ignored. The good news is that if treated properly, most patients get better, and one shouldn't really expect a lifelong life of pain or infertility, depending on what the problem might be, or both. Nevertheless, I don't think we can deny the fact that endometriosis should be regarded to some degree as a chronic condition, which I think makes it even more important that the earliest it is detected, the earliest there's a chance for resolution. And I think one of the reasons why it is become more of a chronic condition is the late diagnosis, whereas some of these pain development mechanism have their ability to ingrain themselves in our nervous system. So I think that's probably the main reason why delay in diagnosis is one of the main reasons why the disease becomes chronic then, in some aspects.
Yeah, that's so sad. I hear this and it just hits over me, But yeah, I know
it's stressful.
Are they starting to include endometriosis in schools so that they educate girls at a younger age? I thought I had heard about that like a bit more.
Yes. Yeah, absolutely. And in fact, I'd like to give a shout out to EndoWatt, which is a phenomenal organization. And this organization is first of all, it's a grassroots organization. It's an information organization. They I don't know if you've not watched the movie EndoWatt, the first one, the new one's coming out. They are phenomenal movies, documentaries actually, that they give such a snapshot of what endometriosis actually is. endo what? What is endometriosis? People asking that. And what they have done is they've gone to school nurses and they've shown the movies to the school nurses so the school nurses can educate people. And I think it's just been an incredible thing that they did. And so a shout out to Endo What. And if you're out there, just look it up on your computer and check out Endo What. And also check out the Endometriosis Summit as well, of course. But amazing organizations that I think are doing a lot of work at the grassroots level, at an educational level, at a school level.
That's fantastic. I think that's really where it needs to start, honestly. So many young girls probably just go their whole lives thinking it's normal and, aren't aware that something like endometriosis even exists. So that's fantastic.
And of course, organization like Patients Like Me, because I think that if one is an adult and has endometriosis and knowing that endometriosis can be heritable, then maybe they're the ones who, if they have a daughter, they could talk to her and communicate the concerns, right? And just pay attention to those concerns.
Absolutely. Do you have any statistics on whether?
And I apologize for using those gender-specific identifiers, but it's hard to teach an old dog new tricks. So I forgive me for doing that, but I'm trying to get better every day. We are trying to get better every day.
Yes, absolutely. Well, great. I guess just to kind of, finish things up here, March is Endometriosis Awareness Month. So in the spirit of spreading awareness, and as one of the top endometriosis surgeons in the US, I wanted to know, what is something that you wish was more widely known about endo?
You got to repeat that question. I lost you. I'm sorry about that. Yeah, we lost the connection for a second. Can you say that again?
I was just saying, March.
You got to repeat yourself.
Yep, March is Endometriosis Awareness Month. So in the spirit of spreading awareness, and as one of the top endometriosis surgeons in the US, I was just wondering if you had something specific that you wish was more widely known about endo.
I think that it's a good question. I think that the one thing that I think would like to know that is not known as much is that endometriosis is associated with pregnancy loss, and I would like to say that because I also specialize in the treatment of pregnancy loss, recurrent miscarriage, and I think that there's not enough awareness about that. And miscarriage is such a personal tragedy, a human tragedy, and I think ignoring the fact that endometriosis can be a potential factor is something that has damaged a lot of people. So if there's one thing I would like people to know about endometriosis is also that if one is having pregnancy losses, repeat miscarriages, endometriosis could be a factor to consider.
Got you. So what would be a next step for someone that was in that situation? What would you recommend that they do?
Bring it up to your doctor. Bring it up to the doctor. Could it be endometriosis? Could this be a factor?
Got it.
And I think that may be a starting point to a proper diagnosis. We call this silent endometriosis. Endometriosis that doesn't have pain, but the symptoms are reproductive failure, failed IVF, infertility, and miscarriage. It's a concept of silent endometriosis that we sort of started. It was actually started initially by Dr. Jeffrey Braven, who unfortunately passed away in 2019. And I think it's like a very important concept, silent endometriosis.
Absolutely. I actually know a few people myself who didn't find out they even had it until they were struggling with, infertility issues. So I'm sure that that's very common, and it's very sad. I guess. Well,
thank you. Thank you very much.
Yeah, I was just going to say, just to, sort of end and summarize, last but not least, is there anything that you can end with that will offer some hope to someone, with endometriosis, especially those that are newly diagnosed?
Well, let's just say that hope means derives also from knowledge. Hope derives from power. When somebody uh, the concept of hopelessness derives from the fact that you don't see anything ahead, that you don't know what direction to go. And I think that if you inform yourself, and there's different, and just today we discussed different organizations. We mentioned Patients Like Me. We mentioned EndoWhat. We mentioned the Endometriosis Summit. And another organization is a Facebook group, for example, called Nancy's Nook on Facebook, that has an enormous amount of information. Uh, uh, when you look at these, and there's others, okay? And when you look at these organizations and you inform yourself, that knowledge will give you power. And that's where the hope will come from. Because once you have the information, then you can get better and you're not going to be alone anymore. And I think that all those things will give you hope. And that's what I think sums up what we're trying to do here.
Yeah, I love that. And I love that you said you're not alone. That's, one of our sort of, brand internally, concepts is you are not alone. And we're really trying to get that messaging out to people that, we really do have a community of support for people to come, especially those who are newly diagnosed and don't have anywhere else to turn. That there's other people out there like them who are struggling and can, be there to offer support.
And with endometriosis, there's millions of people. Believe me.
I know.
Believe me.
Oh yeah, we didn't even talk about that. It's about what, 1 in 10, right? 200 million women worldwide.
1 in 10 women. 1 in 10 women. 1 in 10 women.
That's
just an incredibly huge number.
Yeah. Common is anxiety and depression. Wow. Well, this is fantastic.
Exactly.
Very informative. I really appreciate you taking the time to help us spread awareness about endometriosis, and looking forward to sharing this with our members. Thank you so much for being.
And we're all about change, right? That's what we're about. We got to change the discourse. That's what we want to do. Again, thank you very much. Thank you for having me, Rebecca. Thank you.
No problem. Thank you so much. Bye-bye.